Ladies and gentlemen, good afternoon, and I'm being very proud to be here for your Starter Week and present our simple business model to bring recruiting or bring nursing staff to Germany. May I start with my career, that you know where I came from and why I'm bringing nursing staff to Germany. I've been 10 years ago, I have been sitting also like you in Bayreuth in a Hörsaal like this and listened to some people who talking about business models. And after that, I started my career as a headhunter, executive search consultant. I have been in consultancy companies who are doing consultancy in the healthcare business and the HR business. And I was lack of being in these consultancy firms, and because of that I decided to be an entrepreneur. And I started my first company 6 years ago. It's a classical executive search consultancy firm who is consulting especially German hospitals, healthcare institutes and pharma companies. And after that we have been, somebody talked about the problem with the nurses. And we have analyzed the market in Germany and decided to make our own business to bring nursing staff to Germany. And by side of this, we also built the biggest job platform in Germany, Switzerland and Austria for healthcare jobs. It's like Google for jobs. We have now more than 25,000 jobs per day on our platform. And this is what I'm doing. And also I'm doing some things by side of this. I'm sitting in the health committee of the city of Hamburg and stuff like this. Let's start with the idea. Oh. Das war der falsche Knopf. So, the initial situation is lack of 152,000 to 220,000 FTEs in the nursing sector, estimated in 2025 in Germany. The first number is from the Statistischen Bundesamt, and the second number is from the BPA. That's an institute which is representing the elderly care business in Germany. And first of all, we started with analyzing the background situation in Germany. And we analyzed that 70% of costs in hospitals and nursing industry are labor costs. So 70% these institutions pay for their workers, for the nurses, for the doctors and stuff like this. And after that, we saw that in Germany there's no culture for nursing. To be a nurse is in Germany not, you are not very proud when you're a nurse in Germany. And that's a big problem. And the other problem is that we have no graduated degree in nursing. And in all other European countries, this is all in a graduated degree. So we have a big problem to bring nurses into the job. And then we see that essential conversation of the healthcare sector will be mandatory. We have to change things in Germany in the healthcare business to be able to solve problems we will have in the next 50 to 80 to 100 years. And then we have to, adaptation of business models will be necessary, and we have to do this. This is a background situation. And then we took our view abroad, and then we saw the opportunities for recruiting from abroad. Because we said the German market, we don't have to get on the German market to recruit people here, because when we get somebody from one company to the next company, we are solving a problem in one company, but we are bringing a problem in a different company. So we said, let's look outside of Germany. And then there came a change of legal regulation in 2011 and 2012, which made it able for us to do this. In 2011, there was the Arbeitnehmerfreizügigkeit in the European Union. That means that everybody can change or can move from country to country in Europe and work. For example, a Spain lawyer can work also, a Spain nurse can work in Germany. And in 2012, we also have a Gesetz zur Verbesserung der Feststellung und Anerkennung von Berufsabschlüssen. This means, yeah, but this is very important because without this law, we don't get people to work in German hospitals. So this was the key for us to decide we go abroad and recruiting people abroad. And then decent nursing culture exists only abroad in Germany. So when you go to Spain, there's a nurse, a very proud job. They are very proud to be nurses and stuff like this. And then we have also a tight job market, especially in Southern Europe. We have a good compensation system in Germany. And of all that, we are bringing a win-win situation for foreign employees and the German healthcare sector. So this is what Holm decided with the USP. This is our USP. We bring people from countries where they can't work to Germany that they can work. And so we did this with a 5 steps model. And we have a unique thing on this. Because the first 3 steps, analysis, recruiting, and selection, these are all doing. So this is business like every recruiting firm like Randstad or people like this do. So the analyzing phase is the analyzing of the definition of job descriptions, calculation of needed FTE. Who knows what FTE is? So full-time equivalent, Festangestellte. I think you will learn it in the next month and years. And then the definition of timelines. Because whenever we work, there's a tough timeline behind this, because when somebody didn't the work, especially in the elderly care, you can't earn money, you can't get money from beispielsweise the Versicherung. So after that, we selection target media per country. So we decide which is our media where we can recruit, and after that we do a job post, and then this is a normal recruiting process. We do joint interviews and stuff like this. And then this comes what makes our product unique, because we are doing a preparation phase. And this preparation phase is built in 2 parts, especially the language and the culture trainings in target country in this situation in Germany. Because language is a key factor to be successful in work in abroad, in Germany. When you can't speak the language, you can't do your work as a nurse in the elderly care or in a hospital. You all know this situation that somebody can't talk about his problems, and you have to bring these people to the language and bring them to a level which is good enough to live in Germany and to talk in Germany, or to live in Germany and work in Germany and to talk to people. After that, we do a support of professional validation process in Germany. So we also do a preparation of the hospitals, of the elderly care institutes and stuff like this, cultural training of target institutions in Germany, because they have to learn which people come. They have to learn that there will be good nurses. They have to learn that all these people from abroad are also good people, and they're doing good work. Especially in the German healthcare business, everybody is thinking that these people are working there are the best in the whole world. This is sometimes not real life, because we have in different countries much more better degrees, better schools in nursing and stuff like this. And we have to bring all the companies in the mind that they know which people they are coming. And after that, we are doing a long phase of integration. We support the transfer from target country to Germany. We're doing a welcome package for new foreign employees. This is like the starter week you're doing here. And we are doing the relocation support. We are doing mentoring programs. We're doing further language training in Germany. And after that, we are accompanying these people 6 months in daily life. We are staying next to them, helping them to find a flat, finding a bank account, buying a car and stuff like this. And after 6 months, we leave them alone and they can live in Germany for themselves. And these phases of preparation, integration, is what makes our service unique and what makes us so successful. In the last 10 months, we brought 150 nurses to Germany and helped some elderly care institutions and hospitals to care for their patients and stuff like this. And this is a short example for a business which gets into demographic change and which is being very successful without being very academic. So
thank you very much. Before you leave, can I ask you 2 questions?
Yes.
First question is, who pays you?
The institutions, the hospitals are paying us, and they're doing this without a problem. Because without the nursing staff, without care people, they can earn money. So this is a very special situation, especially in the elderly care. Elderly care is, especially in Germany, we don't have in the European countries abroad Germany elderly care. Also Altenpflege is a typical German situation. And when you don't have enough nurses in your elderly care institution, you can earn money because the Versicherung don't pay for you.
Thank you. Second question, what countries do these nurses come from?
The most, in this situation, the most came from Spain. And we are going now to Hungary, Poland, and doing this in every European country.
So this is inside the EU, Michael?
Inside the EU, because we have these 2 laws. And that makes it very easy for us to bring them to Germany.
Thank you very much.